Guys, welcome back. Danny again with Athlete's Potential. Today we're talking about the shoulder and how we can do some simple voodoo band techniques to the shoulder to help kind of get us to recover a little bit better and improve some, in particularly sliding surface mechanics of the bicep tendon. Okay, so we had a question about this on a Facebook comment, and they wanted to know, hey, what can I do for the bicep tendon? In particular was a slap tear. I can't unring the slap tear. That's going to be there unless you have surgery, but what we can do is we can help facilitate better mechanics of the bicep tendon, which connects to the labrum, which is a slap tear. Okay, so here's what we're going to do. We're going to take the Voodoo band. Again, these are available on Rogue Fitness. This is a mobility wad tool. This is awesome. I think everybody should have one of these. And we're going to wrap the shoulder and then take the arm through some movements that help really put the bicep tendon on stretch to help facilitate some of the sliding that needs to happen in the superficial fascia, which is kind of connective tissue between the bicep tendon and then the skin, which is on top of that. Okay, so wrapping the shoulder yourself can be a bit challenging. So when I teach a movement and mobility trainer course, this is one area where we always have partners help to wrap the shoulder. You can wrap the hip, knee, ankle pretty easily. You can even wrap your elbow fairly easily. The shoulder's kind of hard. All right, so we're going to go over how we do that, and it might take a little bit of practice to get this down, but this is what we're going to do. So we're going to put it over the shoulder, and it's really important that you get your first kind of contact point before you let go of the band. Okay, so I have to be here before I can start wrapping it up, otherwise it'll just unravel on me. Now, as you get it under your arm, you have to hold it with your chin. I know it looks really silly, but it's the only way to do it. All right, so wrap underneath, hold it with my chin, and I'm going to pull tight. All right, we're going to get 50 to 100% tension on the band, and in particular, we want to really kind of emphasize the pull over the front where that bicep tendon is. Okay. Again, 50 to 100% pull. Loop it around, and then once we get to a point where we have a good bit of compression on there, we're actually going to loop it through underneath the band to kind of tie it off, and now we can start doing the mobilizations. Okay, so here's what we're going to do. So with the bicep tendon, it gets really tight when we actually extend the arm behind the back, or when we put the arm behind the back as if we're kind of reaching back into our pocket to grab our wallet. So if we have something where we can put our hand up, a barbell is a great example of this, put a bar on the squat rack, or if you have kind of a counter height, we're going to put our hand back there, we're going to turn our chest away until we're actually facing completely away from our hand, and then we're going to lower down into like a semi kind of pseudo squat position, come back up. We're going to rotate away and squat down until you feel some tension through there, and then let it relax. Okay? So we can do this for a good, probably about a minute or so. It depends on how well you tolerate compression. Some people will get a lot of blood loss quickly. It'll come back once we take the band off. I can tell you this, I still consult with a good bit of Special Forces community, and I was told a few weeks ago by a Special Forces medic that you can leave a tourniquet on for 2 to 3 hours without any long-term implications. So if you leave a Voodoo band on for 2 minutes, I think you'll be just fine. Okay, so last part of this, we're going to take that hand, we're going to put it behind our back. We're going to grab with the opposite hand, and we're going to pull across, okay? So we're going to bring the hand behind the back, grab the opposite hand, pull across, let it relax, okay? So try to get, again, about a minute or so in with this. So you might have this on for a good solid 1 to 3 minutes, somewhere in there. If you start getting a good bit of numbness and tingling in there and starting to freak out, you're getting a little claustrophobic, pull it off, okay? Once we get it off, we're going to go ahead and retest. Make sure all the blood should come back really quickly, usually within a couple seconds we have full reperfusion, and then you can retest that same position and see how it feels, okay? So if you're having some issues with pain here in the front of the shoulder, in particular the bicep tendon, this is an easy way to kind of get some of that sliding surface to restore, break down some of the kind of junky stuff that can develop, and get you back to training. All right, guys, try it out. Let us know what you think. Thanks for watching.